This is Dr. Ali from Implant Pro Center, and today we are going to talk about 5 questions you need to ask your implant dentist before you commit to implant surgery. Question number 1, it is kind of difficult to ask professional what is your experience and your educational background. So if you want to ask the dentist who is performing your implant surgery and restoring your implants about their educational backgrounds and their experience, it's kind of not easy question to ask, but I think you should ask it. Transparency is a key between the dental implant surgeon or the restorative implant dentist who are gonna take care of your implant procedure. So those questions are very important because even though a lot of general dentists nowadays, they are placing implants, but there are different level of complexity and different level of excellence in execution. And to get excellent result, you should know what the educational background of your implant surgeon. There are specialties where people go into like oral maxillofacial surgery or periodontal surgery specialty, and it will take a few years after graduation from dental school. But then whether it's a general dentist who is performing the surgery or specialist, things will vary. Depends on their postgraduate education and how much emphasis on the implant surgery they have in the program of their oral surgery or their periodontology specialty. So those questions should be asked. How long they've been doing dental implant surgeries, how many of them roughly they place. Nobody knows exactly how much or how many implant surgeries they have done in their life precisely, but roughly there are people who done thousands or hundreds, or people who did like very few. So that is very important. When you ask these questions, you will get a sense that the one who is doing your implant surgery know exactly what he's doing or not. The second question you should ask if they are using what the technologies used to the implant placement. Are they using two-dimensional films which normally used in routine follow-up to check for simple cavities or for cleaning and stuff like that, or they are using a 3D CT scan where they get like a 3-dimensional view of your jaw, and based on that they can have better chance to plan your implant surgery in such a way that there's no bad surprises. Nowadays, there are a lot of implant surgeons who do implant surgeries free-handed, and with the advancement in technologies, we do have guided surgeries where the surgery is more minimally invasive and less cut, less post-operative pain and trauma. In Implant Pro Center, we use a robotic surgical arm to assist in the implant surgery. So all our implants we placed are robotically assisted. So basically we get the 3D CT scan in the robotic software, and we plan the prosthetic treatment and the surgical treatment before we do the surgery. So when we do the surgery, we basically do it in very minimally invasive fashion where you can heal very well, and the post-operative pain, most of the times you don't need to have even pain pills the day following surgery. So that is a big key, because if the technology they are using to place your implant is not available, then it's hit and miss, and you don't want to go through that. The third question you should ask, if the surgeon is doing the surgery, is it done in the same place, or you have to go somewhere else to restore your implants? That is very important because you should know who is restoring your implant and putting the tooth or the crown on it, or the bridge or whatever. A lot of times, if there is not very good communication between the surgeon and the restorative dentist, things could get lost, and you could get at the end, when you place implant, basically you are looking not to place a titanium fixture in your jaw. You are looking to get a tooth which will function very nice and aesthetically will be pleasing, and you have less issues of food impaction and bad function and all that. So that's very important question to have answered before you commit to the surgery, because things could go wrong. In Implant Pro Center, we have the whole implant services done under one roof. Even we have dental laboratory, which is fully digital dental lab, where we fabricate, the crowns or the bridges in our own lab to assure that the quality is second to none. Question number 4 you should ask, if the implant surgeon is taking into consideration your medical condition, because not all people have the same ability to recover after implant surgery, and basically your medical history should be taken into consideration. People who have diabetes, their diabetes should be controlled within certain limit. The minimal invasiveness of the surgery is a big key for those people. We do use at Implant Pro Center Periolase by Millennium Company, which basically put the bone and the soft tissue healing on steroid, so you can heal, even you are a diabetic patient, you can heal much nicer and much better, and you have better recovery after surgery. There are people who have osteoporosis issues. They need also to disclose their medication and their condition to the implant surgeon. There are people who take blood thinners. They should disclose that to their implant surgeon, so there is good management of their post-operative bleeding and during the surgery as well. So those medical conditions are very important to be taken into consideration, and you should feel comfortable that the surgeon who's doing your surgery is very well trained and knows how to handle those complexities for you. Question number 5, and the last question, you should ask your surgeon, how accessible are they after the surgery is done? This is a huge, because a lot of times things will go just fine, but in very few times things might not go as good, or you have question, you don't know how to manage certain things, so you need the surgeon to be available to answer to that, whether to see you in person or to answer you on phone and teach you how to manage your post-operative complication. I know there is trend to get the implant surgery done outside the United States for basically financial reason, to save money. So there are people who go to Mexico or to different countries, get their implant surgeries there. I understand that 98% of the time implants are successful, but depends on the complexity of the situation, if there is bone grafting procedure, if there is medical condition. So you need the implant surgeon basically to be available to take care of you in the 2-3 weeks post-surgery, or until you get your implants restored. Another thing also comes to my mind now, talking about having surgery in foreign countries. A lot of times in different countries, when you get your implants done, some of those implants are not FDA cleared. And when they are not FDA cleared, you come to the US, you have them restored, or you have them restored over there, let me say in Mexico or whichever country. But then they are using the implant fixture itself is not FDA cleared, or the prosthetic components are not FDA cleared. So you come to the US and you have a broken screw fixating the crown or the bridge into your implant. And now we are looking for a replacement of that screw, and the screw they were using is not FDA cleared in the US, or the abutment supporting the crown or the bridge is not FDA cleared. So that creates big problem, because you have to go where you got the implant done or the implant restored to get that problem fixed, and a lot of times you end up paying even more, by wasting, time and money and different resources to have all that corrected. So for all that, my advice to you, have your dental implant work locally, and it's good to have it done by someone very accessible to you. So if you need any maintenance or you need any work, you can maintain it well, especially after surgery, for the surgery. So if the surgeon is local, that is huge, and how accessible that surgeon is. At Implant Pro Center, we do have 24/7 answering service to make sure that we answer all our emergencies and we take care of them. So that is a very big key. I hope you enjoyed this video, and I hope the information I put out for you is helpful. However, if you have any question, please don't hesitate to call Implant Pro Center at 415-391-7751. Thank you so much for watching, and we'll look forward to speak about different subjects in the very near future. Thanks.